is Dr. Ataii. Today we're going to talk about the different components of facial aging. This is an important topic because we all are aging, both men and women. We have a diagram in front of me that actually shows those different components, and we're going to go into a little bit more depth. This first image, you'll see that the patient is around the age of 35, nice full cheeks, no under eye hollows, no lines in between the eyes, on the forehead, around the lips, and no formation of what we refer to as the nasolabial folds or marionettes. Around the age of 45, you see obviously some skin laxity, it's the formation of some lines in between the eyes, hollowness underneath the eyes, the formation of what we refer to as the nasolabial folds, and the downturning of the mouth and the thinning of the mouth. And then by 55, obviously, that progression continues to worsen. And that's true for both men and women. Well, what are some of the components? Number one, it's due to the loss of collagen. Some of this has to do with sun exposure, especially the sun exposure you were exposed to in your teenage years can play a role. And then obviously the breakdown of elastin and collagen fibrils. So we use different techniques to enhance this. We can use laser resurfacing, microneedling, chemical peels, and the list goes on. And obviously skincare. Number two, we talk about facial volume. As you see in the first diagram, the facial fat and how it's distributed starts to diminish from the upper pole of the face or the upper half of the face, and it starts to kind of fall down due to gravity into the prejowl sulcus and sometimes even into the neck area. So we need to sometimes use volume replacement with dermal fillers, or we can also use what we refer to as volumizers, such as Sculptra, in order to enhance the volume of the skin. So if you were to consider surgery, they do fat transfer, which also adds volume. Last but not least, we get into how the bone breaks down as we age, and that also leads to the sagging of the skin. Well, we can't replace bone, so we encourage obviously healthy diet, encourage vitamin D supplementation and calcium supplementation, and by adding that facial volume with dermal fillers or the volumizers, we can kind of enhance the bone structure as well. Thank you for listening.